So welcome to the heart blood supply review. So looking at the heart in anatomical position, anterior surface right over here, the apex of the heart over here, and the base of the heart right over here. What you need to identify or locate first would be the aorta, because the coronary, or the two coronary left and right arteries, are coming off the most proximal or inferior portion of the aorta. So what you can see on the anterior surface would be the right coronary right over here coming off of the aorta. It runs along the atrio or right atrioventricular groove, and its first branch that will be given off will be the marginal artery that runs along the right ventricle. And the second artery that you can see on the anterior surface of the heart would be the anterior interventricular, so between the two ventricles, artery. So anterior interventricular artery that you can see over here, which is a branch of the left coronary that branches immediately, which is much shorter than the right coronary, which is a good way to distinguish the two. And its second branch, you can see right here, moving posteriorly, so this would be the left ventricle, and the left auricle of the left atrium would be the circumflex artery. Looking back at the anterior portion or surface of the heart, and focusing our attention to the right coronary, you can see the right coronary continues after branching off the marginal artery posteriorly, as you can see right over here, all the way until it gives off its last branch or its second branch, the posterior interventricular artery, interventricular right left ventricle artery, so right over here. So that's a branch of right coronary, and also the marginal artery is a branch coming off the aorta on the right side on the inferior portion of the ascending aorta, whereas the left coronary that you can see very clearly here is much shorter, about this distance, before it branches into the anterior interventricular artery and the circumflex artery. So that's arterial supply of the heart muscle. Secondly, we'll be looking at the venous drainage of the heart. Unfortunately, we cannot see the venous drainage on this heart, but there's four main structures that you need to know. On the anterior surface, running along the interventricular groove or anterior interventricular groove with the anterior interventricular artery would be the great cardiac vein. Great cardiac vein. You might see some of it. Very hard to see on this one, but it might be coming off over here. Secondly, running along with the marginal artery, you'd have the small cardiac vein, right over here. So great, small, and on the posterior surface, you can see a little bit in this region running with the posterior interventricular artery would be the middle cardiac vein running in the posterior interventricular groove. All three veins, so the great, middle, and small cardiac veins, will drain into the coronary sinus that runs posteriorly in the atrial or posterior atrioventricular groove that you can see right over here. So this would be the coronary sinus that drains all of its blood into the right atrium that we can see right over here. So that's it for blood supply to the heart.